Cholesterol is a fat-like substance that is a natural component of the membrane, or rather covering, of our body cells. So we do need some amount of cholesterol in our system. We just don't need a high level. Cholesterol comes in two flavors. The bad cholesterol, which is called LDL, which is really what clogs up the arteries, and the good cholesterol, which is HDL. And that really is what helps to draw bad cholesterol from the blood vessels back to the liver where it can be excreted. Now, we want to have a low level of LDL. On the average, we don't want LDL levels to go above 100 in most people. And for HDL, which is the good cholesterol, we'd like to see that above the level of 40 in men and above the level of 50 in women. However, based on the new guidelines, we actually now advocate cutting cholesterol levels down by 50% in patients who have either established coronary artery disease or who have a high likelihood of having coronary artery disease, and cutting it down by 30% in other individuals who have elevated cholesterol. An important question is really, what kind of cholesterol? I mean, what kind of vehicle does my cholesterol drive around? How does it roll? That's an important question to keep in mind. And it's not something to be taken lightly, because as it turns out, the type of particle that cholesterol travels around in makes a big difference in terms of its likelihood to get into the walls of the blood vessels and clog it up. If your cholesterol tends to drive around your bloodstream in a small vehicle, tightly packed, the so-called small, dense LDL particles, those are the types that are more dangerous, that are more likely to get inside the walls of the blood vessels and clog up the blood vessels. So in addition to knowing what your LDL or bad cholesterol level is, you also want to know what type of LDL particle you have. Do you have the large, fluffy type that is not as dangerous as a small, dense type of particle?